Doing well in heart remedies at home can help us protect our cardiovascular health. Although there are risk factors that cannot be changed, such as family history, gender at birth, or age, patients can still take a series of other measures to reduce the risk of heart disease. 1. Not smoking is the simplest home treatment for heart disease. Chemicals in cigarettes can affect the heart and blood vessels. Tobacco smoke increases blood pressure, causes tachycardia, and reduces blood oxygen levels. Therefore, the heart needs to work harder to provide enough oxygen to the body and brain. After a year of not smoking, the risk of heart disease is reduced to about half that of smokers. 2. Set an activity goal of at least 30 to 60 minutes per day. Regular physical activity can reduce the risk of heart disease. Physical activity helps control weight and at the same time reduces the risk of heart stress risk factors, such as high blood pressure, type 2 diabetes, and high cholesterol. To be able to do well this home heart cure, we need to set goals. Exercise 150 minutes per week with moderate intensity. Walk at a fast pace. 75 minutes per week for high-intensity activities, such as running. Other gentle activities also benefit the heart. Therefore, if we cannot achieve the above goals, we still have other training plans. Activities such as gardening, cleaning, going upstairs, and walking the dog are all included in the total activity duration. We can start with the above activities and gradually increase the intensity, time, and frequency of training. 3. Applying a good diet for the heart is a way to cure heart disease at home that cannot be ignored. A healthy diet can help protect the heart, improve blood pressure and cholesterol levels, reduce the risk of type 2 diabetes. A heart-healthy eating plan will include vegetables and fruits, beans, protein from lean meat and fish, low-fat or fat-free milk, whole grains, healthy fats. Limiting the following substances in daily meals will contribute to cardiovascular protection: salt, sugar, alcohol, processed food, saturated fat, trans fats, and some fast food, chips, and baked goods. 4. Maintain a healthy weight. Maintaining the ideal weight is one of the simple and extremely effective home remedies for heart disease. Being overweight increases the risk of cardiovascular disease, which can lead to high blood pressure, type 2 diabetes, and high cholesterol levels. We can determine whether we are overweight, obese, or not by measuring BMI. An overweight person will have a BMI higher than 25. This condition is associated with higher cholesterol, higher blood pressure, and increased risk of heart disease and stroke. The risk of heart disease is higher if you have a larger waist measurement. 40 inches, equivalent to 101.6 centimeters for men. 35 inches, equivalent to 88.9 centimeters for women. Losing 3% to 5% of weight can help us reduce some triglycerides in the blood, which has the effect of reducing sugar and the risk of type 2 diabetes. 5. Have quality sleep. One of the other easy ways to cure heart disease at home is to maintain a quality sleep and get enough rest. People who do not get enough sleep are at risk of obesity, high blood pressure, heart attack, diabetes, and depression. Most adults need at least 7 hours of sleep per night. Children often need more. Therefore, make sure that you have had enough rest. Seek advice from a doctor. If you have slept well but still feel tired throughout the day, we need to check ourselves if we are at risk of sleep apnea due to obstruction. This is a condition that increases the risk of heart disease. Symptoms of obstructive sleep apnea include loud snoring, short-term apnea, and panting when waking up. 6. A little-known home treatment for heart disease, stress management. Stress is one of the reasons why home heart treatments are ineffective. Prolonged stress increases blood pressure and other risk factors for heart disease. Some people deal with stress in unhealthy ways, such as overeating, drinking, smoking. This is also the cause of increasing the risk of heart disease. To improve health, we can use other stress management methods such as exercise, yoga, meditation. If stress becomes excessive, we need to seek support from a psychologist. Constant stress can cause mental health conditions such as anxiety and depression. These conditions are also associated with risk factors for heart disease, including higher blood pressure and limited blood flow to the heart. 7. Remind yourself to have a periodic health screening test. High blood pressure and high cholesterol can damage the heart and blood vessels. Periodic screening tests can detect these conditions and provide appropriate treatments. Blood pressure check. Blood pressure check usually starts in childhood and should be done at least twice a year, starting from the age of 18. This helps monitor blood pressure and determine the risk of heart disease and stroke. Check cholesterol levels. Start checking cholesterol between the ages of 9 and 11, especially in the case of other risk factors, such as a family history of heart disease. After the first cholesterol test, it should be repeated every 5 years. Type 2 diabetes screening. People with risk factors, including overweight and a family history of diabetes, should consider early screening. If there are no risk factors, we should start screening from the age of 45 and check our blood sugar levels every 3 years. Besides remembering heart treatments at home, if you find yourself showing signs of high blood pressure, high cholesterol, or diabetes, seek medical advice. The doctor can prescribe medicine and suggest lifestyle changes. Make sure to follow the right dose and practice a healthy lifestyle to maintain good health. 8. Don't forget the vaccination schedule to prevent infection. Some infections can lead to heart problems, such as gum disease can be a risk factor for heart and blood vessel diseases. Therefore, brush your teeth and floss daily. Perform regular dental checkups. Infections can make ongoing heart problems worse. Vaccines help protect against infectious diseases. Therefore, please update the following photos. Flu vaccine. COVID-19 vaccine reduces the risk of serious illness. Pneumococcal vaccine helps reduce the risk of some diseases caused by bacteria. Staph vaccine against tetanus, diphtheria, and whooping cough